Hello, and thank you for joining us for Methodist Healthcare's Breast Cancer Series. This series will provide you with the tools to empower you to take control of your breast health. Today I'm joined by breast reconstructive surgeon Dr. Minas Chrysopoulo to discuss breast reconstructive plastic surgery. Dr. Chrysopoulo, thank you so much for being here.
Thanks very much for having me.
Tell us about the advancements that have been made in breast reconstructive surgery.
Absolutely. There have been a ton of advancements over the last few years. It used to be that breast reconstruction after breast cancer was just about essentially providing a filler for the lady's bra. So now we have techniques like the deep flap and other tissue options that basically replace the filling of the breast whilst leaving the outside essentially looking the same.
What exactly is deep flap surgery and who's a good candidate?
Deep flap surgery uses the lower abdominal tissue like a tummy tuck, and it takes the skin and the fat and that's transplanted to the chest area to reconstruct the new breast. The benefit of this procedure specifically is that it saves all the patient's muscle.
Oh wow.
And especially women that are very active, it's very important for them to maintain all their muscles, their strength, so that they can get back to doing whatever it is that they want to do.
Right, that's amazing.
Yeah, it really is very exciting.
If someone isn't a candidate for deep flap surgery, what are some other options?
That's a great question. So you can achieve a very nice reconstruction with any method. Implants a lot of the time need to be replaced at least once in the patient's lifetime. But the good thing about implants is that it doesn't involve any scarring anywhere else on the body because implants come out of a box. Tissue reconstruction, the tissue has to come from somewhere on the body, and so there's additional scarring. However, the breast after a tissue reconstruction, there's no maintenance long term. Once they're done, they're done. The natural reconstruction gains weight with them, loses weight with them, ages with them, doesn't need to be replaced, doesn't leak, doesn't rupture like implants can. Many women feel like their breasts don't define them at all. So going flat after a mastectomy is an equally valid option. And all options need to be respected, all choices need to be respected. But for those who want to have reconstruction, what's most important is that we tailor the reconstructive technique to the patient's situation and preferences.
That was all very interesting information. Thank you so much for joining us today.
Thanks for having me.
And remember, early detection saves lives. We challenge you to schedule your annual screening. Just go to makeyourmammo.com to schedule your mammogram today.